Good morning. So I have a few notes, and then Marion, Chief of Nursing, will follow up. There are no new cases of COVID-19 to report in PEI today. We currently have 11 active cases and 177 cases since the pandemic began. We received confirmation that 2 of our recent cases were the B.1.1.7 variant, originally identified in the United Kingdom. To date, 13 of our cases have been identified as variant strains, all of them B.1.1.7. In other words, 70% of our recently sequenced samples have been positive for this variant. Canada has recorded over 1.18 million cases and 24,000 deaths. The virus and its variants continue to spread rapidly throughout the country as we experience the impact of the third wave. In Canada, it took us 139 days to record our first 100,000 cases of COVID-19, 123 days to record the next 100,000 cases, and just 12 days to record the most recent 100,000 cases. Case rates are highest among those aged 20 to 29 and lowest among people over the age of 80. Hospitalizations are up 22% and ICU admissions up 21% this week. The rise in hospitalizations is being driven by increases among adults aged 40 to 59 years of age. Over 18% of the hospital admissions require intensive care, and this has been an upward trend. We are still reporting more daily cases on average than we were at the peak of the second wave. The increasing dominance of variants of concern continues to be worrisome. There are over 94,000 cases reported in Canada of the variants of concern, and the majority being the B.1.1.7 variant. The variants of concern spread more quickly, are more virulent, and have a disproportionate impact on younger people. COVID-19 does not discriminate. It affects males, females, young and old, and everyone is vulnerable to this virus. Here in Atlantic Canada, we have seen how quickly COVID-19 can gain a foothold. Currently in Atlantic Canada, there are 585 active cases of COVID-19. And when the Atlantic bubble closed in November, there were 205 active cases. And conversely, when the Atlantic bubble opened last year on July 3rd, there were 5 active cases in Atlantic Canada. Our friends and neighbors in Nova Scotia have reported over 275 cases in the past 4 days, which is more cases than we have experienced in the past year. Nova Scotia has announced sweeping measures to contain the spread of the virus in the Halifax area and throughout the province. Nova Scotians are being asked to stay in their communities unless it is for essential purposes, including work, childcare, medical, and legal appointments. The situation in Nova Scotia is serious, and residents of that province are being asked to take the measures equally as serious. What is happening in Nova Scotia could easily occur in PEI. Even if one person with the virus traveling here from another province or country and not following the self-isolation and testing guidelines puts PEI at risk. If one person with COVID-19 were to arrive here, whether an island resident returning home from travel, a visitor, or a worker, and choose not to be tested and break the self-isolation rules, could result in a serious outbreak of COVID-19 before we know it, forcing us to consider imposing lockdown measures, closing schools, and limiting non-urgent hospital procedures. Given the transmissibility of the variants of concern, we are one bad decision away from having to impose restrictions that could have a significant impact on the lives of all islanders and our provincial economy. As I've said many times, PEI is at risk of importation of COVID-19. I urge all island residents to avoid traveling outside of PEI unless it is absolutely essential. All non-island residents should not travel here unless it is absolutely necessary. In order to further limit the risk of importation of COVID-19, we instituted new travel measures late last week. Specifically, anyone who had been in Nova Scotia or who has been in Nova Scotia since April 16th with a same-day travel exemption, regardless if they have symptoms or not, should be tested on day 4 and 8 following the return to PEI. Going forward, same-day travel self-isolation exemptions will be limited to necessary travel for medical care, work, where you're not entering workplaces or interacting with others, and passport renewal and consular visits. Individuals dropping off or picking up students at airports or train stations are eligible for an exemption provided the specific guidance is followed and individuals agree to a prescribed testing regimen. There will be no self-isolation exemption if an overnight stay is required. Travel for seasonal residents, similar to the rest of Canada, for those coming to PEI, whether it's from within Atlantic Canada or outside, is paused until at least May 17th. Travel to PEI from within the Atlantic provinces under the Family Connection stream may be permitted to provide necessary support. Travel for compassionate reasons will still be permitted. Workers entering PEI from within Atlantic Canada are required to have a negative test prior to entering workplaces, and that is to protect island businesses and families. PEI resident rotational workers and truck drivers must isolate following return to the province unless a negative test is received, unless they are eligible for a same-day travel exemption. And workers who travel to PEI more than once a week are required to be tested at least once every 5 days, and they do not have to isolate while waiting for this test. And effective today, anyone returning to PEI from within Atlantic Canada and are self-isolating for 14 days are required to be tested on days 0 to 1, 4 to 6, and 9 to 11. This change aligns with people traveling both domestically and internationally. The travel measures announced last week are disruptive to many people. We would have preferred not to impose more restrictive measures for people traveling to PEI from within Atlantic Canada. COVID is disruptive, though, and it can be equally devastating, particularly for the hundreds of people who've had loved ones in hospital, ICU, and those who have died of COVID. The reality is such that our neighboring provinces are dealing with outbreaks, and COVID-19 is once again knocking loudly on our door. So not only does the virus not discriminate based on age, the virus knows no borders. In fact, it passes easily across borders. Given the situation in the Atlantic region, it is incumbent on us to take all reasonable steps to further tighten our already strict border measures, increase isolation and testing requirements for people coming to PEI, and limit travel to and from the province. These steps will further reduce the risk of importation of COVID-19 and protect the health of islanders. We will also be tightening up our self-isolation procedures, which I'll mention in a couple of minutes. We know these measures are inconvenient for many people. These measures will be time limited. They are in place for now and not indefinitely. I would much rather be here to explain why certain steps were taken as opposed to explaining why we did not act. It is important that we protect the health of islanders as well as our healthcare system. Healthcare professionals and systems across the country are under strain. Field hospitals are in place to meet the demand for COVID-19 related care, and systems have moved to essential services and canceling elective procedures. Our goal is to protect our health system, allowing islanders to access a full range of services. Health PEI staff, border screeners, the Office of Public Safety, and the CPHO team worked tirelessly over the weekend to implement, really enhance these border and testing measures. Testing access has been enhanced for workers and commercial truck drivers at Borden, Slemon Park, and Charlottetown, including the provision of rapid testing for rotational workers, truck drivers, and work isolators. Thank you to everyone involved and for your support and cooperation. Self-isolation is a foundation of our provincial pandemic response because it is effective in breaking the chain of transmission of the virus. In PEI, there is a legal requirement for individuals to self-isolate. Up until this point, it has been acceptable for individuals to self-isolate in a home with someone else, provided guidelines are followed. We have always recommended that individuals self-isolate away from other people. Isolating completely away from others reduces the risk of transmission to anyone else. And there is a risk of transmission when someone is self-isolating with others. However, the risk is reduced provided the self-isolator follows the rules. Going forward, we will be doing more education and assessing isolation plans carefully. And if these plans are not acceptable, our office will be working with individuals to assess the risk and, if necessary, improve their isolation plan to further reduce the likelihood of any potential transmission. We remain focused on immunizing as many island residents as quickly and safely as possible. As of Saturday, April 24th, a total of 49,896 doses of vaccine were administered, including 10,291 second doses. 29.7% of adults over the age of 16 have received at least one dose of vaccine, and 7.7% of island residents have received 2 doses of vaccine. We remain on track to vaccinate everyone who is eligible to receive their first dose by the end of June. Every Tuesday and Thursday, we update the provincial website with information about the number of vaccines that have been administered. This information is also reported nationally. This week, individuals aged 40 to 59 can book appointments at the Health PEI mass immunization clinics across the province based on the month of their birth. Pregnant women in PEI who are healthcare providers or those working with the public were already included as priority groups to book vaccine appointments. Now all pregnant women have been identified as a priority group. Those who wish to be immunized are now eligible to book vaccine appointments in accordance with the recommendation from the Society of Obstetricians and Gynecologists. The SOGC states women who are pregnant or breastfeeding should be offered vaccination at any time during pregnancy if they are eligible and no contraindications exist. Pregnant and breastfeeding women may want to contact their prenatal care provider to assist in making decisions, weighing the risks and benefits so they can make a well-informed decision for what is right for their situation. Second doses will be scheduled approximately 12 weeks after the initial dose. In PEI, we will continue to offer the AstraZeneca vaccine in individuals 55 years of age and older. Anyone who wants to get this vaccine can contact one of our 12 partner pharmacies across PEI. The National Advisory Committee on Immunization, or NACI, recommends the use of AstraZeneca for those over the age of 30 in regions with moderate, high, or very high COVID-19 disease. In PEI, the disease pressure is very low. Hence, we will continue to offer this vaccine to individuals 55 years of age and older. NACI recognizes that provinces and territories are responsible for determining their vaccination policies, and the use of AstraZeneca will vary from jurisdiction to jurisdiction based on local COVID-19 epidemiology and vaccine supply and logistics. For those under 55 years of age who received AstraZeneca as a first dose, there will be a recommendation coming soon regarding second doses. In PEI, we will have enough messenger RNA vaccine, mRNA vaccine, Moderna and Pfizer to fully immunize all eligible residents against COVID-19. As announced last week, we will be receiving a substantial increase in the amount of Pfizer vaccine between the end of April and the end of June. And we are planning to increase access to vaccine through community pharmacies, and more details will be available soon. I want to clarify perceptions of a high number of no-show appointments, and Marion may speak to this as well, suggesting that vaccine is being wasted. I can assure Islanders that vaccine is not being wasted. All vaccine is used judiciously, and every dose that can be injected into someone's arm will be offered. Clinics are planned to ensure that few, if any, doses are left over at the end of the day, and any extra doses are allocated to individuals who require the vaccine for compassionate or health reasons. For example, if someone has to travel out of province for a medical procedure, or if someone is about to start treatment for cancer, they may be booked at the end of the day to receive any leftover doses. The online booking system sends 2 automated reminders to individuals who have scheduled appointments 7 days prior to the appointment and the day before the appointment. I encourage anyone with questions about the vaccine to please visit the COVID-19 vaccine website, where you will find useful information about the immunization rollout, the vaccines being used in PEI, and how to book and prepare for your appointment. All Islanders should book their vaccine appointment when it is your turn. Thank you to all Island residents who've already booked your vaccine appointments. As I mentioned earlier, there will be vaccine for everyone who wants to be immunized against COVID-19, and one dose provides good protection, and a second dose is required to boost immunity and provide more sustained protection. One of my team said to me, "I have never been more worried since the pandemic began," and I could not agree with them more. There are good reasons to be very concerned given the situation around us. We remain vulnerable in PEI until our vaccine rollout is complete, and we've achieved our objective of having 80% of eligible island residents immunized with 2 doses of vaccine. Now is the time for each of us to step up and take responsibility for our own actions. Get vaccinated, get tested if we have any symptoms, pay attention to the public health basics, follow the rules, and look out for one another. Our individual actions matter. We also need to work together to avoid the potential for a lockdown to protect ourselves and others from the devastating impacts of this virus, including the variant strains. If you are aware that someone is not following the self-isolation rules and are putting themselves or others at risk, please let us know by calling 1-800-958-6400. And as we do every week, and some weeks we have to remind ourselves and others more than others. So let us continue to be patient and continue to be kind. Thank you.
Thank you, Dr. Morrison. Good morning, everyone. The Joint Response Team continues to monitor the ongoing COVID-19 situation in PEI and across Canada. We are thinking of our colleagues in Nova Scotia and across the country as we monitor the situation this week. We've been working closely with Dr. Morrison and her team and our partners to provide the required additional means of testing and continue our vaccine program to limit COVID-19 on PEI. Yesterday was our first day with enhanced testing for our truck drivers, rotational workers, and work isolators. Those individuals are being thoroughly screened at the borders and are able to receive a rapid test. All people who are tested with a rapid test receive a card indicating the date and time of their test. The rapid test results are complete within 2 hours, and if a person who has a rapid test does not receive a call from public health within that time frame, their test is negative, and they can proceed with their approved work or work isolation plans. Yesterday, 205 people received those rapid tests. I want to thank everyone involved in this effort with our dedicated swabbing and testing teams at the sites across PEI and our laboratory and point-of-care testing team. They worked hard with Dr. Morrison's team and the border screeners over the weekend to quickly adjust our testing capabilities to meet the new requirements. We appreciate the support from transportation and our partners in information technology throughout these changes as well. We do know that fast, effective testing is key to limiting the importation of the virus and allowing our economy and province to continue to function. Our vaccination efforts continue to go smoothly, with approximately 1,000 people each day receiving the vaccine at our large clinics. This week, we'll be booking all adults aged 40 to 49, and as of today, any individual in that age group born in the months of January through to June are able to book their vaccine appointments. Beginning tomorrow, individuals born in the months of July through September can book, and on Thursday, individuals born in the months of October and December. Next week, we will open our booking to another large age cohort, those ages 30 to 39. They will also be able to book their vaccine appointments according to birth month in 4 groupings. So beginning Monday, May 3rd, individuals born in the months of January through March, and on Tuesday, May 4th, individuals born in the months of April through June, and Wednesday, May 5th, individuals born in the months of July through September, and on Thursday, May 6th, any individuals aged 30 to 39 born in the months of October through December can book their appointments. And of course, they can book directly online using our online booking system at princeedwardisland.ca/getthevaccine. This is the quickest way to book your appointment, and it's very easy, and the system is open 24 hours a day. For those who aren't able to book online, they can call 1-844-975-3303 to speak to one of our booking clerks. An appointment is required to receive your vaccine at our community clinics for all individuals. And I want to reassure everyone as well that we have appointments available to everyone, and everyone will have the opportunity to be vaccinated by the end of June based on our current supply projections. If you are unable to attend your appointment and you need to reschedule, or if you choose to get your vaccine at a pharmacy instead, please do call and reschedule using the online booking system or by calling the 1-844 number. You will receive an automatic appointment from our clinics with notification of your second dose appointment time within the coming weeks. You don't need to call the 1-844 booking line to book your second dose appointment, and we do ask that you not book your second dose appointment online. We will automatically send you your appointment time. There is an option on the 1-844 line to cancel, reschedule, or check your vaccine appointment at our community clinics, and you can also cancel by clicking the link provided in the confirmation message you received from Skip the Waiting Room. We want to make sure that people do not book an appointment online if you've already received a dose of the AstraZeneca vaccine in our community pharmacy. If you have received the first dose of AstraZeneca, you cannot receive a second dose at our community clinics. Our community vaccine clinics do not have the AstraZeneca vaccine and are only providing the Pfizer and Moderna vaccines. Your second dose must be the same product as your first dose at this time, as we're not mixing types of vaccine. So it is important for people to know which vaccine they have received, and if you need a copy of your immunization record, you may request this at the time of your appointment. We're working with ITSS on a web form that people will be able to use if you've already received both your first and second doses to request your immunization record if it's needed, and we hope this will be available soon. I want to thank everyone once again, especially our swabbing and testing operations team, and to all the members of the public for continuing to keep our island community and healthcare system safe by following the public health requirements for testing, physical distancing measures, gathering limits, and the isolation requirements. We do see our friends and neighbors in the Atlantic provinces and across the country struggling at this time, and we've been fortunate here to get through this pandemic together. We have to continue to support one another through this current phase of the pandemic. Thank you.
Thank you, Marion. And we'll open it up for questions.
Dave Stewart, The Guardian.
Good afternoon to you both. I guess my first question would be in relation to the Charlottetown Airport and the recent number of news releases that came out in terms of positive cases on some air travel into Charlottetown. Should we be looking at considering the situation in other jurisdictions and how worrisome it is? Right now the news releases state that people should monitor for symptoms. Should it be mandatory that people get tested if someone on that flight was COVID positive?
Hi, Dave. So actually, on the flights that are coming in, they, by far the majority, all are in isolation, and most of them are all being tested because they're coming in from outside Atlantic Canada, and they're all being tested at day 0 to 1, 4 to 6, and 9 to 11 days anyway. So they're in isolation for 14 days, and they're getting tested 3 times anyway. So it's really the advice is to even monitor for symptoms even in between those times. So not wait an extra day if you're having symptoms. So that's actually what's happening already. And so I'm glad you asked the question so that people know that that is occurring. And even if people are coming to work or are rotational workers, they are already on a testing regimen as well. So that it would be, they have to get tested 0 to 1, 4 to 6, 9 to 11 if they're rotational workers. If they're work isolators coming in from outside the province and are going into workplaces, they're tested every second day. So already a lot of that testing is in place. And it really is just to enhance, to make sure that if you have any symptoms, not to wait for your routine testing regimen to get tested. So I think that's just something to note. And in terms of overall testing, and I think maybe I can almost anticipate your next question, that we are trying to do more testing at the point of entry at the bridge. We've done a pilot test at the airport, but we are also working as quickly as possible with Health PEI and partners to look at what our testing options are at Wood Islands Ferry and at the airport, recognizing that testing will continue to be important for all of us to recognize COVID early and make sure that people do get their first test as conveniently as possible. So I think that's what we will anticipate getting there, but it's not there at the airport now, but they do all require that day 0 to 1 testing.
Thank you very much for that information. I guess I'll follow up with, a number of weeks ago, Ontario requested some help, any help that PEI could provide. Have we sent any healthcare staff to other jurisdictions?
Yeah, hi, Dave. I'm not sure. We did send a request out to seek if there were interested staff, and there is a process that those individuals who come forward from our Health PEI system can identify themselves if they would be interested in supporting based on the needs that were requested by Ontario. I'm not aware that any have gone or what the numbers are in if the people who had even put their names forward, but I can follow up with our communications people to send you some of that information.
That's great. Thank you very much.
Thank you.
Gabrielle Drummond, Radio-Canada. Good afternoon to you both. Ma question, c'est en français pour la docteure Heather Morrison. Vous avez répondu à moitié en anglais. C'est par rapport aux tests rapides que vous offrez aux camionneurs et aussi aux autres travailleurs qui arrivent ici à l'île pour accélérer l'obtention des résultats des dépistages. Alors, on sait qu'il y a une augmentation du nombre de cas de COVID-19 ici en Atlantique. On voit en Nouvelle-Écosse, il y a aussi la présence des variants, le variant indien. Est-ce que vous pensez que le fait d'utiliser les tests rapides maintenant, est-ce que ça pourrait représenter un risque d'importation de la COVID-19 ici à l'île, parce qu'on sait que certains de ces tests ne sont pas assez fiables et efficaces?
Bonjour Gabrielle. Alors, on utilise un test qui c'est pas un test rapide antigen parce qu'on n'a pas aussi de confiance en ce test. On utilise un test qui est rapide, c'est ID Now, c'est un test molecular test, et puis c'est presque la même confiance qu'on a avec d'autres manières de test. Alors, c'était les mêmes tests qu'on a utilisés à l'aéroport et on a fait les tests avec la test rapide et aussi avec l'autre test qui s'appelle PCR. On a fait les deux pendant le période à l'aéroport. Et puis, on parle souvent au laboratoire. Alors, c'est pas... Tous les tests rapides ne sont pas vraiment la même. Alors, ils ont des tests qui sont un peu différents. Alors, on a confiance dans ce test et c'est aussi, on veut avoir les résultats aussitôt que possible, mais encore la majorité des personnes ont les autres tests et s'il y a des travailleurs qui sont ici pendant plusieurs jours, ils doivent avoir les autres tests pendant les 14 jours et puis la plupart du temps, ça va avoir, c'est aussi des PCR tests.
Tout à fait. Et est-ce que, on sait que bientôt, on aura le service de traversier qui va être offert entre l'île et la Nouvelle-Écosse. On sait ce qui se passe là-bas présentement. Est-ce que vous allez aussi utiliser ces mêmes tests rapides au traversier? Quelle va être votre stratégie pour le traversier?
Gabrielle, on est en train de discuter, même ce matin, on a mis nos efforts depuis quelques jours au point d'entrée, au pont, mais on parle les plans avec le traversier et aussi à l'aéroport. Alors, on va avoir un plan d'ici quelques jours parce que le traversier, je pense, ouvre le 1er mai.
OK, parfait. Merci beaucoup.
Merci.
Marine Ontenot, La Voix.
Good afternoon to you both. J'ai une question pour vous en français, Dr. Heather Morrison. Je voudrais savoir si l'objectif de vaccination de 80% de la population adulte est atteint dans un mois, qu'est-ce que ça pourra changer dans la vie des insulaires si la situation reste critique dans les autres provinces et dans les provinces atlantiques?
Bonjour. Alors, on est en train de regarder quoi les mesures qu'on peut ajuster quand on a au moins 80% des personnes qui ont au moins une dose de vaccin. Mais on sait, même à ce point, on va avoir, nos enfants ne sont pas vaccinés. Est-ce qu'on a besoin d'un deuxième vaccin avant de changer trop de choses? On discute, on a des conversations dans la région atlantique, mais nationale aussi. Quelles sont les mesures qu'on peut ajuster si on voit que la plupart des personnes sont plus protégées? Mais ça va aussi dépendre le montant de COVID-19 qu'on a ici au Canada. Alors, c'est une bonne question. Je ne pense pas qu'on a tous les détails d'une réponse, mais on discute parce que je sais que tout le monde veut qu'on arrive à un moment donné qu'on peut avoir pas les restrictions de santé publique même que maintenant.
Merci. Et deuxième question, à l'inverse, si la situation donc reste critique dans les provinces voisines, est-ce que les gens de ces provinces qui seront vaccinés pourront malgré tout venir à l'île? Est-ce qu'on pourrait se diriger vers une espèce de passeport vaccinal?
À ce moment, la chose la plus importante vraiment est que la population ici à l'île du Prince-Édouard, les insulaires, sont protégés le meilleur que possible. Alors, même si à ce moment, même si quelqu'un d'autre est vacciné, s'il vient ici, il doit isoler pendant 14 jours parce qu'on n'a pas, la population ici, les insulaires ne sont pas protégés en grand nombre. Alors, je pense à un moment donné, peut-être ça va changer les mesures si vous êtes vacciné ou sinon, mais c'est encore quelque chose qu'on discute comme région, comme pays, et je sais qu'ils discutent ça vraiment au niveau international aussi.
Merci beaucoup. Bon après-midi.
Bon après-midi.
Rachel Collier, The Eastern Graphic.
Hi there. I've been keeping an eye on the CTV's national vaccine tracker, and I noticed that PEI has vaccinated the smallest percent of population and the smallest percent of eligible population in the country. I guess despite having a health system that's been less taxed than other provinces. I'm wondering if there's anything in particular causing this relatively slow rollout, or if there's anything that you'd maybe add to that.
Well, hi, Rachel. I think it's important to look at certain sources when you're looking at the vaccine numbers, and I think they're really challenging, and this has come up at different times. Sometimes what's reported nationally in terms of the vaccine delivered, it lags behind or ahead of what actually vaccine has already been administered. So our vaccine that actually has gone into people's arms is very much in keeping with the national average, and we've done so in a very efficient way. So it's very challenging because each of these sites is looking at it a little differently, and it's based on numbers that sometimes aren't all at the same time. For instance, we know we only get a certain amount of vaccine every week, and we know if that vaccine comes in, we have to have enough for all the appointments that week. So we can't include those numbers in the ones that have been administered. So we're sort of just making sure that we have enough for everyone that has appointments, thousands of appointments every week. So I actually, I would say that the source where you could look for the up-to-date numbers, Rachel, are on our website twice a week that they're updated in terms of the numbers of people and the percentage of people. And what's also going to be added there too are some a little bit more demographics, and then as time goes on, the age, the percentage of each decade will also be in there who've been vaccinated. So I think there's good information there that gives a more accurate and up-to-date picture of how we're doing.
Okay, so it's more of maybe a timing issue with reporting than the fact, like, we're not actually necessarily lagging behind other provinces.
Exactly.
Okay, all right, thanks for that.
Wayne Thibodeau, CBC.
Good afternoon to you both. Dr. Morrison, if I could start with you, I just wanted to follow up on a comment you made regarding, I believe I heard it correctly, about expanding the mRNA vaccine to pharmacies. Does that mean when we get our 47,000 additional doses of Pfizer that you're going to look at putting some of those vaccines into island pharmacies?
Hi, Wayne. Actually, what I think the plan is currently, and we're working with the Pharmacy Association as well, and certainly in conjunction with Health PI, our anticipated shipments of Moderna, which are in the thousands over the next 2 months, we'll have enough second dose. We'll keep enough Moderna aside for Health PI second dose clinics that will be required, and a certain amount of Moderna will need to be kept for those clinics. But then the other Moderna vaccine would be going to pharmacies.
Okay, thank you very much. I also wanted to, I think this is probably best question to you as well. We're hearing from some landlords, this come up early on in the pandemic and seems to be coming back again regarding self-isolation. So landlords telling us, for instance, that someone self-isolating in their home are being told by public health officials, yes, you can go outside in the backyard for a walk, but they're saying in a home that's easy. In an apartment where you are going to be touching common surfaces and elevator doors, landlords have some concerns about that. And one specific case where an individual moving from New Brunswick was told they could come over for the day, move their furniture in, but then had to go back to New Brunswick. Again, landlord raising concerns about that possibly putting either the tenants in that apartment building or the staff in that building at some risk. Can we chat a bit about what happens for self-isolation for those who are in apartments in PEI?
Okay, Wayne, I think it's a good question because it really picks up on what we were talking about in the notes around the importance of self-isolation and even some of the changes that have been made more recently about same-day exemptions. And I think there was certainly when we didn't have as much disease in the area and same-day exemptions were being considered. I think we're really trying to be very careful and make sure that people are tested, even if there's a same-day exemption granted for medical reasons or appointments in IWK or in St. John, for instance. So that's one part. But in terms of apartments, they are really challenging, and to be in an apartment without any outdoor space is really difficult for people for 14 days. We've certainly talked about if you're on a ground floor apartment, if you can have if there's a back patio, you can go outside onto the space and then come back inside. And I think that fresh air, and if you're not interacting with anyone else, that may be fine. If they are not able to leave the apartment grounds, and there are certain protocols certainly for if they have to try to leave the apartment, but there are really some there's some good information, I think, online that we have looked at as well, Wayne, about what we would expect and require anyone to do if they were isolating and they needed to get outside for some reason. Our preference is, of course, that they minimize any kind of contact with anyone else so that they don't put anyone else at risk. As you know, we have sometimes people in hotels, and then they can use a back door to get outside and get some fresh air, but that is under supervision. It's difficult. We hear a lot of concerns around people self-isolating. Our Operation Isolation, of course, is talking to them every day and giving them some guidance if they need some, but also making sure they're doing not struggling with that isolation time. So it is of concern, Wayne, but we've been trying to certainly minimize that with the advice and the direction we have. And they can't go out for meals. They can't talk, they can't hang out if there's a common area in the apartment building. They have to have increased hand washing. They have to wear a mask if they have to walk down the hall. But, I mean, the best case scenario is that they stay in their apartment and are able to be on their patio, and that's it.
And can you just clarify, so if you're moving into PEI, are you allowed to come in here, move your furniture in, and then go back to the mainland on with the same-day exemption?
Well, I think that's interesting because I'm not sure I am aware of that particular incident you're speaking to. So that person from New Brunswick would have to apply for approval to get here, and they'd have to come for certain reasons. And so there may have been it may be a university student, but it's an unusual thing to be approved if you're just coming to drop off furniture. So I may need to get back to you on that particular situation that you're referring to, Wayne. But there are only certain reasons that people get into the province. Certainly some same-day exemptions may have been granted for medical appointments. Emergency veterinary services is another one that people might have to bring their animal over to the vet college. But those are certainly minimal, and we are, as you've noted in the last 10 days, we've really tried to be tighter on that, and the Office of Public Safety is also aware of that and are looking at all those people trying to get into Prince Edward Island. And our border screeners are asking the questions, even more so than they ever were before.
All right. Thank you very much for your time. I appreciate it.
You're welcome.
Louise Martin, CBC.
Hi, good afternoon to both of you. Dr. Morrison, I think this one will go to you, and it is about the guidance on AstraZeneca. And given the fact there are still, lots of appointments available at pharmacies on PEI and that this batch expires at the end of May, what is the harm in offering it to younger Islanders?
Well, I think NACI has clearly said if there is a messenger RNA vaccine, mRNA vaccine, that is going to be available in a timely way, the vaccine, the preferential vaccine should be the mRNA vaccine versus the AstraZeneca. And that anything other than that is really a risk-benefit. And so we have looked at some of the evidence. They have said absolutely, at this point in time, they recommend going below 55 to age 40 to 30 only if there is moderate, high, or high levels of COVID-19 activity in the province or in that region. And we don't have that here at this point in time. So we know we have, in a week's time, more mRNA vaccine coming. We're working very hard to keep COVID-19 limited importation or spread in this province. So I think we have vaccine appointments available in that 55-plus category. We'll continue with those. But we are certainly following NACI's advice on this going forward. And if we were in the middle of Toronto, Louise, we would be giving different advice. But we're not there, and we hope we're not in that situation.
Understood. So what about the supply of AstraZeneca? How much do we have now? When is PEI getting more? And if we're not mixing vaccines, as Marion Dowling mentioned at this point, I know there's clinical trials happening around that. What about and I know you said there will be some news on this, but what about the 20-year-olds who are wondering about what they will get for that second dose? Some of them are booked for that in June.
Yes. So So I guess a couple of things. One, that we will have AstraZeneca. There's about 3,000 doses in the province, and that haven't been used yet. And like I said, but the appointments can still happen for 55 and older. And those we will be able to get more AstraZeneca in for second doses for anyone 55 years of age and older who requires a second dose. And those who are under 55, we will be waiting a decision from NACI, and I think I mentioned that, Louise, and a direction, and that will be either to get a second dose of AstraZeneca or an mRNA vaccine. So either way, there will be enough vaccine for second doses for those 18 to 29 who received AstraZeneca.
Thank you so much for your
You're
time.
Welcome.
Maude Montrando, Radio-Canada.
Oui, bonjour. Ma question pour Dr. Morrison. Je me demandais, quand vous réfléchissiez aux mesures pour garantir la sécurité des gens en quarantaine puis éviter d'autres éclosions, est-ce qu'il a été évoqué de faire comme le Nouveau-Brunswick, puis d'envoyer les gens 7 jours ou plus à l'hôtel? Et j'aimerais ça un peu savoir votre réflexion à ce sujet-là.
Bonjour. On vient de discuter, on sait que le Nouveau-Brunswick, mais tout le monde doit payer eux-mêmes pour un hôtel pour 7 jours. Et puis l'autre 7 jours est chez eux. Et puis, c'est assez difficile pour, je pense, un grand nombre de personnes, et puis c'est assez cher. Mais et c'est pour cette raison qu'on discute la meilleure façon de s'assurer que les personnes isolent comme il faut. Alors, je sais que c'est une manière d'avoir les personnes isolées s'ils doivent payer pour un hôtel. Et on met déjà un nombre de personnes ici pendant 14 jours dans les hôtels. Et puis, si on a besoin, on va mettre d'autres personnes, mais à ce moment, et puis on fait ça depuis plus d'1 an, vraiment, et on va continuer d'en faire, regarder les plans pour isolement, et puis essayer de s'assurer qu'ils isolent toutes seules ou avec hors des autres personnes.
Je me demandais justement comment se fait concrètement la vérification des plans d'isolement. Comment vous jugez qu'un plan est correct ou qu'un autre ne l'est pas?
C'est vraiment les personnes au Office of Public Safety, puis et on donne de l'éducation vraiment, sur l'Internet, mais on ne veut pas qu'ils partagent une cuisine. On veut qu'ils ont une salle de bain qu'ils ne partagent pas. On peut avoir beaucoup de... On veut qu'ils soient vraiment séparés des autres et qu'ils n'ont pas les interactions entre eux. Peut-être c'est quelqu'un qui habite sur le sous-sol et puis une salle de bain là-bas et puis on met les repas juste aux escaliers sans du contact. C'est peut-être c'est possible, mais s'il y a d'autres choses, c'est pas vraiment... C'est un risque pour les autres qui sont dans la même maison.
Je vous remercie beaucoup. Je vous souhaite une belle journée.
Merci. That's it. Thank you very much.